So I live in Canberra and I live with my partner, Patrick, and our beloved golden retriever, Rover. I'm a clinical speech pathologist who's been working in rural and remote parts of Australia for the past 10 years. I was born in Darwin in the Northern Territory and have worked up in the NT and all the way down to the Hay Plains in a small town called Coleambally, where I probably first saw the inequitable access that's provided to people who live in remote parts of the country to healthcare services and essential services like speech pathology and allied health. I'm the CEO and founder of Yarn Speech, which is a digital intervention platform designed to help reduce wait times and wait lists for children and families who are stuck on the 4-year wait list for speech pathology services here in Australia. So it's a 20-month wait for access to assessment and then a further 24 months to get in to get an intervention for your child. And so when we most commonly see children who are diagnosed at the age of 3, maybe 3.5, then waiting 4 years, they're 7, they've started school, and we've started to see a really big sort of vicious cycle of negative impacts of the fact that they don't have the vocabulary and capacity to communicate effectively as little people. I decided that it was time to try something different and do something about this, and so I've stepped away from the clinical world and have moved into the tech space, and we're building an app that parents and children can do in the comfort of their homes wherever they live across the country to be able to get the ball rolling and get them moving before they get in to see that speech pathologist in 4 years' time. The main message behind what we do is it doesn't matter where you live in this country and it doesn't matter how geographically isolated you are, you should be able and entitled to receive good quality allied healthcare no matter how far you are from the city. And so we think that the ways that we do that maybe need to bring in something a little bit more technological, because the answer isn't always putting a speech pathologist in the most isolated part of the country. But what we can put there is something that a family can download on their station in far Western Australia or on their farm in New South Wales. And then they can do that with support, with evidence-based activities that are built by clinicians from the comfort of their own home. So I first got this idea for this project when I was a student on placement in the Northern Territory. And I remember them talking about 3 sort of different models and kind of deciding which one they were going to do for that year. And oh, we've done this one last time and that didn't work so well, so let's try this and let's try this. And we just kept rinse and repeating these methods because that's all we had, and we don't have other opportunities, and there aren't other things that we can use because they just don't exist yet. And so I think we opened the catalyst of using technology through telehealth during COVID, which was an exciting moment. But telehealth doesn't negate the fact that we still have a disparity between the demand for speech pathology services and not enough clinicians on the ground. So we need to rethink the ways that we can provide services using technology that can still get to the people, but without having to have a clinician there all the time. So when I was announced as the state winner, we were able to take the Westpac grant and put into place a genuine pilot program of Yarn. So we've been really excited to be working with a speech pathologist in the Leeton and Narrandera area, where we believe that we'll be able to roll out our platform in its minimum viable product form to a bunch of children who are currently stuck on the wait list out there. I said I was going to completely redesign the way that we delivered allied health services across this country, and I still firmly believe that's what we're on track to do. We're starting in speech pathology, and I'm so proud that I can bring that clinical lens and that experience at the coalface of the problem to the solutions that we're designing. And we work with speech pathologists across the country to input to the platform, which is something I also love. But it's really just the start of where we hope to go over time, and we hope that we can expand that across allied health more broadly to occupational therapy, physiotherapy, dietetics, and bring one platform that can provide kind of that holistic care for kids who can't get in to see clinicians.